and welcome to this episode of the Queen Bee podcast. Today we're joined by Dr. Nicole Avard and Georgie Drury, two of the founders of Metluma, which is a doctor-led initiative that provides an innovative and compassionate team-based approach to supporting and empowering women in their midlife. Thanks for joining us today, Georgie and Nicole.
Thanks for having me.
Thanks for having us.
Great. Well, let's start with this concept that you guys have of a smart health community for menopause. How is it new for women?
Well, Nick, why don't you start with the whole flipping the model of care? I think that's a better way to start with your experiences of why we need a smart health community.
Yeah, thanks, George. So I've been in general practice for 20 years now, and the landscape has clearly changed significantly, and then really significantly changed after COVID. Having access to kind, compassionate care is a systemic issue that's becoming more and more difficult. And it's not because GPs are not kind and compassionate, it's just that the squeezes of the system are getting tricky. So the way that I see the model of care is it's a bit like an iceberg. People are struggling, they have an illness, they have something they need to see a GP about. There is delays into getting into most doctors, even in metropolitan areas these days. And then the doctor is kind of the pivot point to everything else. So the doctor then drives education, drives behaviour change, drives investigation, drives treatment plans, drives access to or recommendations to allied health. And that's a pressure that the system is crumbling under, because at the moment, the way the system is set up, it doesn't really facilitate for longer consultations and everything that needs to be unpacked in order to access all of those things. And menopause is a classic example of that. Georgie and I have kind of discussed flipping the pyramid. So how could the concept of a smart health community, which means high touch, high tech solutions, so leveraging digital interventions and behaviour change before you even see the doctor, be dispersed and distilled for people that may be illness specific, that may not be illness specific, because often lifestyle changes can be kind of dispersed across the whole population for a whole range of illnesses. So it's about using digital technology to uplift health literacy, to improve self-efficacy and empowerment, to then look at remote symptom monitoring and track behaviour change. Envelop that with an allied health team that can be monitoring that and coaching accordingly, and then get to the doctor when the doctor really needs to be involved with all that stuff done before they see the GP. Now, having said that, there's always red flag processes, right? So if right at the top of the scale when we're collecting data digitally, there is a red flag, then you skip everything else and you're straight to the doctor. So it's just reinventing how we could deliver healthcare to improve accessibility and leverage technology to take the heavy lifting off GPs.
So if I was the patient coming in, what would that experience be like for me? What kind of process would I personally be going through?
Well, this is all an experiment with Metluma,
yeah.
Right? So that's a great question. I think the first touch point is that however you got to us, we would then encourage you to download our app. And then the app is an interactive journey around two things. One, collecting your data securely of what your symptom load is and what your lived experience is for our first test case of this scenario is menopause, and collecting data on red flags, and then channeling you to a journey that's appropriate for you. So the journey that we have at the moment is a range of videos and articles on menopause education. So seeking out delivering accurate information so that women are empowered to make the right decisions for them, so that when they get to the doctor, they understand exactly what's going on and what their options are, as opposed to requiring a whole consultation to discuss that through. So that's kind of the first step. And then as the data is being collected in the background, we can flag and triage according to red flags, orange flags, green flags, and put a human into the process as soon as is required, whether it be a nurse or a doctor. So in the first instance, it would be downloading an app and going on that journey, and then kind of engaging into the human component according to what your needs and desires are. And it may well be that you want to engage with a human straight away, and so we could then see that. But there are people that might just want a better understanding and an increase in health literacy and understand what their options are before they go and speak to a doctor.
Yeah, I think if I just want to add there, Tanya, I feel as a consumer, I only ever take time off work or take time to see a doctor when I'm really at a state of distress, when I'm really at that sick point. And I think that it's how can we proactively help women. And so I love to say I've got Dr. Nick as my guardian angel on my shoulder, that I don't have to wait till I'm in the fetal position rocking on the floor thinking I've got to go see a doctor, that it's what can I do today to actually circumvent that actually happening. And I think that with a lot of perimenopausal symptoms, we can actually do that, which would be wonderful.
And that sounds really great. When I recently went to see a different doctor at our local clinic, there was a form to fill in, which was great because I didn't have to be thinking on the spot. I didn't have to have my list of things. I could do the thinking beforehand. So when I'm in the room, I can focus on what's actually happening. And I know the questions to ask. If I've got that research there, I can sort of go, okay, well, does this sound like me? And okay, so then instead of asking, what do I need to do? I can say, it sounds like this. What are my options? And it's a different conversation then, isn't it?
Yeah, and it's one that requires a bit of courage, both from the patient and the practitioner, because we're used to an illness model of care. We're used to you're sick, you go see the doctor, where we're trying to encourage a wellness model of care. So you're well, how can we keep you well? We see your barometers, we see that maybe you're not sleeping so well, maybe your steps have dropped off. Let's understand what's going on for you there. You know, has there been a stressful incident at work? Are you unwell? And then the coach can step into that. As to Georgie's point, the coach can step into that space and say, okay, we notice that sleep's gone a bit wobbly. Here's 3 practical things that might help you with that. However, when you do become unwell, let's get the doctor involved straight away.
2 examples that I can sort of share about how the technology in Metluma can help with the heavy lifting. The first thing is okay, if I wake up and I've had postcoital bleeding, without a doubt, you need to see a doctor. So that'll tell you now, don't wait, go and see a doctor. So you think, great, I'll actually do something about it before a month later and it keeps going. Or the second thing is if you wake up and you think, oh, I've got sore boobs, what's going on? Like the last time I had sore boobs, I was pregnant. You think, oh my God, what's happening? But then you can sort of say, well, it's Christmas time and you've probably been out and had a few more drinks at Christmas parties. Then you wake up and have a few more cups of coffee than you normally would. So then we'd say, well, why don't you back off the caffeine and the alcohol for a week or 2 and then see how you feel? So that, again, it's helping you feel like I've got control and I'm empowered to make my decision, that it's not breast cancer, I don't need to run away. We're not excluding that, but it's that whole piece of how can we work with you so that you can feel at ease to get on with your day and that your health is not front and center, what am I going to do, or at the back of your mind either.
And so that sounds a lot more like a traditional Asian style or Chinese style of medicine where it's like it's about keeping you well, not about fixing the broken bits, which is, I mean, generally we're trying to treat the symptoms. And this sounds like it gives us a chance to go a lot deeper.
Yeah, that's an exact analogy. So yes, in traditional Asian medicine cultures, I think practitioners were often paid on how well their population, or rewarded how well their populations were, not paid for how sick they were. So, I mean, there is a systemic issue of funding that we haven't got time to go into, but we're trying to just do it a little differently because primary care is going to be well and truly broken by 2035.
Yeah. Definitely.
We also see that menopause is the gateway to aging well. So what women are concerned about is their brain fog or their hot flushes or their sleeplessness. So you can actually use that as a fabulous opportunity to come in and say, well, let's get your base well now so that you can age well and that we will have you under control for osteoporosis and cardiovascular disease. And let's look at what's going on, whether you've got diabetes. And so we really see that that's the opportunity to have that really robust conversation to help women age well, because we're in this sandwich generation now, right? Like we've never had so many women over 40 in the workforce ever before. And we don't know what that looks like in a very patriarchal society. Whilst we're managing our elderly parents and we're looking after our children, some of us have got newborns at 40, whereas other ones have got these revolting teenagers. So we're in this interesting situation that we've never been at before. And so we're really wanting women to put themselves first. It's like, put your oxygen mask on first, and then you can actually cope with what else is around you.
And you mentioned coaching earlier. So how does the coaching help when you're going through menopause or perimenopause? Because we tend to think of it as being just about hormones.
Look, I think Georgie raises a good point there around the gateway to aging well. So basically, we don't know what women want until we ask them, and accordingly, a woman or a person assigned female at birth often knows what's best for her. She knows how to heal herself. It's just kind of navigating the noise of what's going on to try and find clarity with answers. But there's probably three buckets then. There are people that are just happy to receive education and highly motivated and nudge themselves accordingly, and we'll just high five them and give them nudges and saying, you're doing awesome, well done, check in with us if you need. So we're that little guardian angel. And then there's the kind of, let's call them the orange flag group, classic to Georgie's example, where there's a squeeze and time is precious, and we don't want to be setting up a cycle of failure where everyone knows what they need to do with sleep and movement and alcohol and food, and how the hell do you fit that into your life? So it's what we describe as walking alongside women. So having a human to say, okay, we've noticed this and this. Do you feel like you could lean into a behaviour change that may make a positive impact? Or is it that you actually just need to lean back and rest? So just helping kind of have a safe, compassionate space to allow women to tap into when they feel what they feel is right for them at any point in time. Because menopause is not a boot camp. It's not like that, we know that perimenopause and menopause can last for 4 to 10 years, leading into menopause being one day in a woman's life, which is 12 months after her last period. You don't boot camp your way out of that. It is a journey where you have to resource yourself with accurate information, empower yourself with what is right for you, and surround yourself with a tribe that's going to help you navigate that accordingly. So that's where we see the coaching fitting in, is to, when do you kind of need someone to nudge you up and say, okay, get your sneakers on, let's get going. And when do you need someone to just give you permission to say, actually, you just need to rest, and then working that out over time, so that the woman it gets more empowered to make those decisions herself. Because by doing that, we're then putting scaffolding in place, hopefully, for positive behavioural change and acceptance around sleep, movement, food, which is all going to feed into ageing well with osteoporosis, dementia risk, cardiovascular risk.
And to talk to that, Nick mentioned tribe, and what we've gone and done as part of this Smart Health community model is validate a group coaching model. So we've just done a big research piece with Western Sydney Uni, paid for by the Digital Health CRC. And so we don't want women to be alone. Like, I love the concept of self-care, but where the gold is with shared care. And that's where we really want to say, you're not alone. Come and join our group coaching sessions if that's what's right for you. And we've had some phenomenal results because these women feel like, I'm not alone and I don't have to do this all by myself. And you just see their shoulders just go, oh, thank God someone's listening. So think of it for those that have had children, and it's like a modern day mothers group. So you've come out of, you're in this new, what is going on with me? Because we've never ever as little girls been taught what's going on with perimenopause and menopause, and unfortunately neither of our doctors. So it's how do we unpack that all together? And so Dr. Nick holds a very safe space for women to come in, and it's that really richness in that tribe and community and that concept of group coaching.
And I always find group coaching is an amazing experience anyway, because you get that borrowed benefits. You may not be sharing or asking the question, but when someone else does, we all learn from it. So
exactly,
I find it so much more effective even than one-on-one coaching at times.
And as Nick said, we are running out of doctors. They are a finite resource. So how can we use our special doctors like Nick to have the same conversation with, 8 to 10 women in a room, as opposed to having the same conversation in a one-on-one consult 10 times a day? It's a way more efficient use of her time. So we actually think that it's a supply and demand benefit as well.
Yeah,
Yeah.
it's been a really amazing experience for me to run the digital journey alongside the group coaching, because they'll watch their digital journey, they'll bring that to the session with their questions, and then the vulnerability of the shares, like right from the get-go, I'm like, whoa, you guys are really courageous. And while there is power in practical advice and information sharing, as Georgie says, and as you've highlighted, the biggest power is in the validation and the shared community.
And we don't want to replace anyone's local GP, right? But GPs are generalist practitioners. And as we say, they haven't done a lot of study in this space, whereas someone like Nick and our team of doctors have gone and specialised in this space. So it's how can we actually work with a shared care model with their own GP to say, I might just pop over here to the right for a couple of years and work with Dr. Nick, but Dr. Nick can feed all that information back to that family GP or whoever they've got in that space as well. So it's not like we are taking on your entire healthcare. It's just for this piece of time, like you would work with an obstetrician for that piece of time with a baby. We really see that we can bring up that specialist GP to work with you at that specific time as well.
Yeah, and I imagine that by sharing that information back, you're also educating the doctor as well and giving them a
100%.
chance to get a bigger picture of what's going on for you.
Yep.
Yeah.
Because they're like, I can't be all things to all people. And
Yeah.
so if they know that there's that, but over here on the right, they're going to be the experts that can work with us. But I mean, Nick, you're doing it at the coalface every day, working with a whole range of GPs that just love that you're helping them help their patients.
Yeah, I mean, that's right. It's as general practitioners, unless you have a need or a desire to step into women's health and do further training, then like everything, we know lots of things about lots of things, but not a deep dive necessarily into one thing unless you take a special interest in that. And once again, there's not a lot of time for us in a day. You know, I mean, I'm churning through 25, 30 patients a day, and that's probably not a lot for a general practitioner. You know, some are pushing 50 or 60 just to, you know, keep their practices sustainable. So we want to work alongside GPs to help them with their patients to keep them doing what they need to do, but feel the load a little less.
Yeah. And I'm interested, now we're talking about menopause and perimenopause. What were your experiences with that on a personal level?
Well, I'm 49, 50 this year. I'd have to say my experiences were probably pretty similar to most women. Like, I've got teenage children and parents that are aging, and I am busy at work. So that the squeeze has been significant in terms of emotional energy. Sleep has been disturbed. I don't hot flush yet, so I'm thankful for that. My period is still pretty regular. My go-to is definitely my tribe and nature. So if I don't move my body 4 or 5 times a week, then my kind of physical and emotional health will feel the impact of that. And I've got a great tribe of people around me, both in family and friends, that just hold space for when it's great and when it's tricky. Which is why I'm all the more passionate about this, because while I understand it from a professional point of view, I can empathise with women in the room.
So for me, I'm 47, but I also have an IUD, so I actually don't know where I'm at from a period perspective, and that old school way of defining menopause as the absence of a period. So I have no idea. But I feel that for me, it's the increased level of fatigue. And I used to train every day, and I actually have had to pull back from the training because I was so fatigued. So even though you're exercising all the time, you actually still feel really tired with it. So I've had to watch things like caffeine and also things like alcohol, just because I do feel that, you know, you have a few glasses of wine now and that really can trigger anxiety. So I've just got to be really mindful of that.
Yeah, and fatigue is one of those ones that we kind of forget about when we talk about menopause symptoms. Like, we're just tired all the time. But I know I've struggled, but I never think about that when I talk about what my symptoms have been when I'm talking to women. It's always like, oh yeah, you know, the hot flushes. For me, the jerky legs was really annoying.
Yeah.
But you know, the anxiety. But I never think about the fatigue. And yet there were days where I was like barely dragging myself out of bed. And yeah, it's so interesting that we just kind of really filter what we think of as, that's what that is.
I was doing was masking it with a lot of caffeine. So you've got to stop that, right? So that you're actually listening to your body and saying, yeah, so I don't drink a lot of coffee anymore. I'm on teas, but it's that was one learning for me for sure.
But you're right. I mean, as women, we normalize experiences that are not meant to be normal. Period pain. It's like when I speak to young women that come into the clinic and they're like, I'm not talking to them about their periods, and they're like, oh, my period's normal. I get pain day 1 to 3, and I'm like, whoa, whoa, whoa! Like, period pain is not normal. Like, let's kind of take a step back. And so we normalize that being in your 40s or 50s and tired all the time is just how life should be, but it doesn't have to be. There can be some things to unpack with us on how to make some changes to that. But yeah, what did you do?
I just had to slow down. Like, there'd be weekends where I would just be hardly doing anything. Like, I'd lie down a lot. And luckily, my husband was really supportive. But it's like what you say, the conversation comes back to people saying, oh, you're just overdoing it. Then we're not talking about it as being actually, this is something that is physically going on because I'm going through this hormonal change. We're just saying, oh, you've got a lot on. We've always got a lot on. That's what we do. But this is something else. And I think that people aren't necessarily listening to what we're saying. They're listening to what their assumptions are around what would be your normal. Yeah, I know I do too much, but that doesn't mean that I should feel like this unless there's something else going on, because I've always done too much.
And I think the tricky thing is having a level of comfort in being uncomfortable, in people's uncomfortableness. That makes sense. So, like, as a doctor, there is an immediate kind of empathic response that, oh, gee, I want to fix Tanya's fatigue, right? I want to step in and fix Tanya's fatigue. And sure, that there may be a space for that, but there is also a space for kind of leaning back and just holding space and compassion and acceptance around, well, Tanya's tired and that's not okay. And we'll just kind of sit there for a bit and see what kind of percolates out of what strategies could Tanya use to fix her fatigue.
Yeah, and it's not always about, again, fixing that symptom, but thinking about what else is going on. So I know we've spoken a bit about your smart health communities. Can you tell us a bit more about Metluma and what you're doing there in that space?
So I think that we really see that, as Nick said, the care needs to get fixed, right? And yes, we could wait for the government to do it, but I think as working women, we're spending money trying to find these solutions. So if you can come and find us as a one-stop shop for women's health, that's really what we want to build, so that we can actually help everyone deal and help navigate what's going on with their health. So whilst we're starting with the perimenopause and menopause piece, we're super interested in neurodiversity and ADHD. We're also looking at medically induced menopause. And so how can we actually really create a safe space for women to come and unpack what's going on in midlife? I think if we can then solve for that, and dare I say solve for mum, it's how can we then solve for the daughter, and then how can we solve for dad? Because I do think that the mum is generally the head of the household, and if we can get her working well and feeling well, then we can then reach out into other members of the family.
I love that, because every time I go away on a trip or something, my husband's always like, oh, I'm going to have to take time off to look after the children. I'm like, they're at school. You just need to organise yourself. But there is this thing, if you do hold so many pieces together, isn't there?
Yeah. So many plates.
Or all the dads that go, oh, I've got to babysit Saturday night. I'm like, no, it's called parenting. It's actually not babysitting.
Love it. So is there anything else you ladies would like to share while we're in this space together?
Don't normalise or just dismiss your experience. Reach out to us for help. We're here. We're here to listen. We're here to point you in the right direction of a solution that's right for you. Perimenopause and menopause for some is okay, and for others is really significantly difficult. So don't suffer in silence. Seek out accurate information. Seek out help from a general practitioner. If you can't find that practitioner, then reach out to us or keep looking until you're finding that safe space to get accurate information.
Yeah, I think that, Tanya, if I can just really reiterate that I think the old school day of you go in and you sit across from the table from your doctor and you wait for them to give you all the answers is past. And so we really need to help women have dialogue with their doctors because, as Nick says, they know best what they do, what they know about themselves. And so it's that, how do you get that advocacy for yourself to keep trying to find that right place? And we're lucky in Australia, you can choose doctors. Like in the NHS, you can't. Where you live is where your doctor is, and that's how it works. But I would love to see, Tanya, how we could get some of your community to test and learn from Dr. Nick. I don't know if we can put a reach out to some of your members and come up with a promo code or get them to come and try and have 8 to 10 of your group together to experience Dr. Nick and then get feedback on that, because that's how we build community together, is we test and learn.
That would be awesome. And so how do people connect with Metluma? I know you've got a website, but how do they get involved and get on the app and all those sorts of things?
Yeah, so how it works is you need a Kickstart code to access the app, because either your work's paid for it or you've paid for it or your insurance has paid for it. So you can reach out to us and then we can give you that Kickstart code. You can start with us from as simple as, $89 for a year access to the app and the rich content and the symptom tracking. And then we can have tiered approaches with how you can access our doctors and our nurses. But we would love to, have you guys on a group coaching session, or you can access Dr. Nick as a one-on-one and the other suite of doctors that we have. Really open to, how we can work together.
And what's just like coming through my mind is it cost me $90 to see my doctor for a very short consult, even when I'm going in with all the things I want, my list. $89 actually sounds really reasonable to get access to all those resources.
Yeah, it does. We think the same thing. And just to have that access in your back pocket, and then when you need to dial up or dial down, you can. Because not everyone needs to see a doctor every week, but you need to have that insurance policy that when you do need to see a doctor, that you can have access to it. So that's where we're really looking to see how we can meet women with where they're at and give them the tools they need at that point in time. Especially if we think of rural and remote, Tanya. I mean, you are up the top end of Australia. And so if we think about menopause doctors, and this has become really clear in the Senate inquiry, so the Australian government has put a call out for submissions for the perimenopause and menopause in Australia, and there's been over 250 submissions. We've now concluded 7 days of hearings, and the Australian government is coming up with their recommendations mid-September. So it'll be interesting to see what they come up with. But fundamentally, it is access to care. And so the beautiful advent of telehealth is wherever you are in Australia, we can actually help you. And then we can work with your local GPs as well.
Yeah, and I love that, because I know for me, it's usually a month to see my doctor. And we're in a regional city where we've got lots of medical practitioners, but most of them are full. Whereas if you're out like much more rural or remote, you don't even have that as an option in some cases. So having medical support on your doorstep has got to be such a godsend for people.
Yeah, and we're coming from research. So, in a previous life, I was very fortunate to do a remote monitoring of cancer patient study. So we do know that the high touch and the high tech piece works. So you can put your Garmin device on, and all that data can feed into us, and then that builds out our rich AI so that over time we will trust the recommendations coming out of the computers, of the algorithms, that will be exactly what a human will be thinking. So it once again helps the heavy lifting to be done, and then frees up doctors to do what they do best.
Yeah, well, that sounds so exciting. And even if you don't think that you would have perimenopause, you need to start thinking about, getting to understand the symptoms. Because I know for a start, I'd never heard of it. When my friend first said to me, I think you might have perimenopause, I'm like, what? And it certainly wasn't a conversation that my doctor had, or even when I raised it with him, it was like, oh, you're really young. I was 47. But But for those people who do have children in their later lives, I feel like they are, from the conversations I have, more likely to start experiencing those symptoms, and possibly because it goes postpartum into perimenopause, which is what mine did. Making sure that we're having those conversations with your older mums, 35 plus, of saying, maybe you need to just check your symptoms, and maybe you need to have these conversations. Maybe it is postpartum, but maybe it might be the start of perimenopause, and how do we support you early before it gets nasty?
100%. I think this is this whole piece of you don't have to fall off the edge before you can empower yourself with what's about to happen to you. And I think that to me, exactly what you just said is, Nick puts it under 28 symptoms, under 3 buckets. So the physical, the cognitive, and those not spoken about. But the amount of women say, I had no idea there were 28 symptoms. So that menopause is more than just hot flushing. And that's, what we need to be learning. And I go to the schools and I say, well, why can't we learn about perimenopause and menopause at the schools? And the teachers are like, we're struggling to get little girls to 25 with what's going on with consent and all these other things right now. We're not concerned about what happens to them at 45. So the question is, who is interested in that space? And so whilst we wait for the government to come in and pick up some of that work to be done, at least I want your viewers to know that we're here. And so we can definitely help. Which is great. You don't have to be alone.
No, and I think that's a big thing.
It's a good point you raise about like having conversations early, and I just want to use the weight gain as an example. So often I'll get people coming through my door in their mid 50s, and weight gain is a common symptom of perimenopause and menopause. And it's not that I can't help those women, but if I could have had that conversation with them in their late 30s and 40s to say, hey, look, your caloric need is going to change. You need to start thinking about building some muscle as you're moving towards 50, because that's going to help placate some of the central weight stuff. It's just way easier.
Yeah. Yeah, and I know I gave a presentation last week about perimenopause and menopause, targeting Gen X and Gen Y. For a start, the first half was stunned silence. And then when we talk symptoms, they're like, oh my God, I have that and I had that. But then there was some older ladies in the room who were like, I'm really concerned now because my doctor's never raised these things with me. And I'm worried that I'm going to have osteoporosis, or I might have the startings of it, or, these other things happening because they haven't had those conversations.
And I think women need to have that. They need to have the choice. They need to be educated to make that choice. So, we see a disproportionate amount of women being prescribed SSRIs to help with their anxiety. But have they been given the choice that they should be thinking about things like HRT or MHT as well? So it's just enabling women to have that ability.
Yeah, and not thinking about, again, symptoms in isolation.
Correct.
Well, thank you so much for your time today, ladies, because it has been a really interesting conversation, and I am really keen to check out this group coaching approach. So expect my name on the list of people coming up.
Yep, that'd be wonderful, Tanya.
Yeah. So today we've been yarning with Georgie Drury and Dr. Nicole Avard from Metluma. Georgie is a seasoned entrepreneur and CEO with a passion for health and technology. And Dr. Nicole is a very experienced integrative GP who blends private practice with work in GP education and training, as well as being a clinical adjunct with the National Institute of Complementary Medicine. Together with Jara Eddy, a clinical nutritionist, they are the founders of Metluma, which we've been hearing about today, which is an online medical support provider for women going through their midlife. Thank you so much for joining us today, Nicole and Georgie.
The opportunity, always great to share, and any nuggets that we can help women in this space is always a privilege.
Thanks, Tanya. It's been wonderful.